Good day everyone, I am OSMOTIC DIURETICS. My generic name is mannitol. My brand name is mannitol osmitrol resistisol. And my chemical name is DIS. Now, let's talk about my drug classification. My pharmacologic drug classification is osmotic diuretics, and my therapeutic drug classification is diuretic. Next now is my pregnancy category. My pregnancy category is C. Now, let's talk about my mechanism of action. Mannitol increases the osmotic pressure of glomerular filtrate, inhibiting tubular reabsorption of water and electrolytes, thus promoting diuresis. This action also promotes urinary elimination of certain drugs. Mannitol promotes the urinary excretion of toxic materials and protects against nephrotoxicity by preventing the concentration of toxic substances in the tubular fluid. This effect is useful for prevention and management of acute renal failure or oliguria. This action is also useful for reduction of intracranial or intraocular pressure because mannitol elevates plasma osmolality, enhancing flow of water into intracellular fluid. Now, let's talk about my pharmacokinetics. First, in absorption, it is absorbed poorly. Small amounts are absorbed from the GI tract. In distribution, it is administered intravenously, concentrated in extracellular compartments, and does not penetrate the blood-brain barrier nor the eye. In metabolism, it is metabolized minimally to glycogen in the liver. In excretion, it is excreted in urine, which is unchanged. Its time and peak intravenously is up to 1 to 3 hours. The half-life elimination in IV is up to 4.7 hours. Now, let's talk about my indications. It is indicated to the cerebral edema, reduction of raised intracranial pressure, reduction of raised intraocular pressure, oliguric phase of renal failure, renal function testing, and lastly, the transurethral prostatic resection.
Osmotic diuretics, contraindications, side and adverse effects, and nursing interventions. Contraindications. In rare patients that do not respond to test doses, active cranial bleeding, pregnant women, and lactating mother. Side and adverse effects. On the cardiovascular system, cellular volume expansion, heart failure, pulmonary edema. In the central nervous system, headache, hypernatremia, and hypotension. In the urinary system, dehydration. In the digestive system, nausea and vomiting. Nursing interventions. Assess for contraindications, and it is to prevent unwanted complications. Perform a thorough physical assessment of the patient, conducting a detailed physical test to create baseline data before drug therapy starts. to ascertain the efficacy of therapy and to assess the frequency of any adverse drug therapy-related effects. Inspect skin to assess hydration status and to provide a baseline data for drug therapy for efficacy of data. Assess pulmonary status to measure fluid movement and hydration status. The effects on the heart and lungs will also be tracked. Obtain accurate body weight to provide a baseline for fluid balance monitoring. Monitor for input and output voiding patterns for the evaluation of fluid equilibrium and renal function. Evaluate liver status, determining possible issues in the metabolism of drugs. Monitor the laboratory test results. It is to determine the drug's effects. Monitor the liver and renal function result. Identification of the need for future modification of the dosage and dose.